Hello everyone, welcome to this video to wrap up our discussion of adults and geriatrics, especially focusing on health promotion and injury prevention. For health promotion, we covered a lot of the important stuff already. We already discussed nutrition and strategies for grocery shopping. We discussed alcohol use, what's safe, what's not, and the audit screening tool. And then we just about finished our discussion of sleep, how everybody needs to sleep, but most people don't get enough sleep, and remember, it's harder to sleep the older you get. Some other important things to discuss here are exercise, and of course, stress management. And they do go hand in hand. Exercise is a form of stress management. So for adults in the United States, the recommendation is that exercise is at least 150 minutes every week. So that's at least 5 days, at least 30 minutes of activity. Those 30 minutes of activity can be broken down into 10-minute chunks if someone really does have a hard time fitting that into their day. And the recommendations keep getting easier and easier. Pretty much as long as you're moving, we'll take it. It's much better than sitting in front of a computer all day long. So for stress management, again, that exercise is a piece of that, but this also includes things like getting enough sleep and taking time for yourself, social interaction with close friends, journaling, managing your time, and all those things that I'm sure you guys are great at as a part of nursing school. As we move on to injury prevention, I'm going to bring that picture up again we've been looking at that shows all the leading causes of death by injury for the various age groups. Depending on how old your adult is, we might have different things to look at. For example, our younger adults, here in this 24, 35 kind of age range, we have unintentional poisoning, motor vehicle traffics, and then homicide and suicide seem to be the big deal. Unintentional fall is really quite low. But you'll notice as we get older, that unintentional fall just keeps stepping up until for our 65 plus age group, unintentional falls are actually the leading cause of death. For the unintentional poisoning, I'll just point out to you again that that is largely the opioid deaths that we are looking at. And then the motor vehicle traffic accidents, I'm sure you guys can imagine those. Number one for adult injury prevention needs to be discussion about drug overdoses. So this includes encouraging people to not get hooked in the first place, talking about responsible opioid use for pain management, working with healthcare systems to reduce the amount of opioids that are prescribed. For families, friends, naloxone education, getting that Narcan out there, making sure people know how to use the nasal spray. And then, of course, ultimately, we need addiction treatment as well. The next one down was motor vehicle accidents. So traffic safety is going to be a big deal. And, you know, car manufacturers are working on this. They've added airbags, they're fixing seatbelts and fancy collision avoidance systems, but ultimately reminding people not to drive drunk, not to drive and text at the same time, making sure you're not distracted, don't drive while you're tired. And then there's this question, the older you get, when do you stop driving? That 90-year-old great aunt that I kept talking about in class today, she stopped driving when she confused her accelerator and her brake and accelerated into the back of a big Ford F-250 pickup truck. She had a perfect tow hitch imprint in the front of her car and broke her leg and ended up in rehab for a few weeks. Some people, though, don't have quite a dramatic wake-up call like that, and it just comes down to a family discussion of, gee, Mom or Dad, you seem to be driving on the wrong side of the road a lot. Gee, Mom or Dad, your vision seems to be really bad. A lot of older people really resist giving up a driver's license because that is often the last form of independence that these patients have. If they now rely on other people to drive them around, then they feel sort of trapped at home. Social life decreases. Even nutrition can decrease because people aren't doing their own grocery shopping as often as they would like anymore. So if we are going to discuss getting rid of someone's driver's license, then we also need to discuss other ways to help maintain their quality of life. All right, another common cause of those injury deaths on our chart was suicide. So just like we talked about with our teens, we're going to do suicide screening. We're going to push for more mental health care in the country and do what we can to prevent those suicides. Educating families too about warning signs of suicide. So especially if someone is already diagnosed with depression, so people know what to look for. And then remember that last age group where falls became the cause of death. So we need to do the home safety assessments. So this is making sure the toilet is an appropriate height, making sure there aren't those little throw rugs all over the place, putting electrical cords behind furniture, making sure there's adequate lighting, no slip mats in the shower, and grab bars in the bathtub, all that stuff that I'm sure you guys remember. A piece of this also goes back to the polypharmacy that we were talking about. Especially with some of those blood pressure medications, if the dose is a little too high or the patient tries to stand up a little too fast, then that can be a contributing factor to those falls. Okay, so that about does it. We had mostly finished up this discussion in class. I'm also going to post just a little bit of a review study guide for you guys on Blackboard so that you have something, since we didn't have the chance to do our pre-exam review like we usually do in class. As always, find me, email me, call me if you have any questions.